Good evening, everyone. A very warm welcome to all our distinguished speakers, respected nursing leaders, healthcare professionals, educators, students, and participants joining us from various parts of the country and around the world. On behalf of Nurseslab, it gives me immense pleasure to welcome you all to this national webinar organized in observance of World Blood Donor Day 2026. This year's theme, One Drop of Humanity, Give Blood, Save Lives, reminds us that every voluntary blood donation is an extraordinary act of compassion, solidarity, and hope. A single unit of blood donated has the power to save multiple lives and strengthen healthcare system across the globe. As nurses and healthcare professionals, we stand out at the forefront of patient advocacy, transfusion safety, donor awareness, and community education. Through this webinar, we aim to deepen our understanding of the current challenges in blood transfusion and transfusion practices, explore evidence-based approaches in transfusion nursing, and reaffirm the vital role of nurses as ambassadors of voluntary blood transfusion. We are deeply honored to have with us three eminent speakers who have made remarkable contributions to their respective fields. We extend our heartfelt welcome to Dr. Deepthi Sachin, Senior Consultant and Clinical Lead, Department of Transfusion Medicine in Dr. Rela Institute and Medical Center, Chennai. We are privileged to welcome Mrs. R. Nikitana Nair, Chief of Nursing, Fortis Hospital, Mohali, Punjab. We also warmly welcome Professor Shilpa Jain, Professor cum Vice Principal of ARK Jain University School of Nursing in Jharkhand. Let us come together to learn, inspire, and strengthen our commitment towards promoting safe blood practices and saving lives through knowledge, leadership, and compassionate care. Once again, thank you for joining us. Wishing you all a meaningful and enriching learning experience here at Nurseslab. Now, without further delay, let us begin today's national webinar on Blood Donor Day 2026. Thank you. To introduce our first speaker for this evening, it's my honor and privilege to welcome Mrs. R. Nikitana Nair, Chief of Nursing, Fortis Hospital, Mohali, Punjab. Ma'am has graduated from her BSc from Sharmila College of Nursing and PG MSc Nursing specialized in OBG from SRMC, Chennai. Ma'am has also completed her MBA in Hospital Administration from Madras University, MPhil in Hospital Healthcare Management from BITS Pilani, and is currently pursuing her MSc in Psychology from Madras University. With over 16 plus years of experience in the field, Ma'am is also having a lifetime membership of the TNAI, CAHO, ANEI, and the INS. Ma'am is also an instructor from the American Heart Association for BLS and ELS training. Ma'am has also participated in various audits, internal audits, as a clinical auditor and nursing excellence in the NABH 5th edition, as well as an internal counselor. Ma'am is currently has 3 paper research presentations published, and is certified in Yellow Belt in the Lean Sigma program. Ma'am is also a world record holder, Einstein world record holder as a trainer. We welcome you, ma'am, and over to you.
So good evening. Today my topic is all about on blood transfusion nursing, the crossmatch to the bedside. This is one of the most keen topic and a very important topic that we have to look into actually, because the major issues is like the major, the errors which starts from the blood transfusion is all because of the nurses at the bedside. Apart from the laboratory, there are a lot of legal cases which has been running around in today's, high court. So major responsibility lies with the nurses right from her sampling, identification of the patients, and to the bedside of the blood transfusion. Why is this topic that matters a lot? Like every unit matters that you give for the patient. Globally, many millions of blood units are being transfused annually, but at the same time, along with the transfusions, that also carries a lot of errors along with the patients when you give it. wrong blood in the tubes remains a leading cause of the transfusions errors that you look into. Majorities of serious transfusion incidents that occurs along with the bedside is increasing day by day. Most of the errors by the nurses can be prevented through the nurse being more proactive at her bedside. Well, the safest transfusion is only because of the correctly when it is being prescribed, when you correctly identify where and what it is with regard to the patient, errors and everything. Along with that, we are carefully monitoring the patient. Well, the blood transfusion is nothing but transfusing a blood volume from a healthy person who has got no problem with regard to his quantity or quality of blood within him. He transfers that to the patient whose quantity and quality is very less. Now, what are the types of products that we're going to transfuse? There are almost 9 products that we have in the transfusions. The first one is going with the packed cell, platelet, fresh frozen plasma, factor concentrate, granulocytes, cryoprecipitate, whole blood, and your protein solutions. Here again, you have got types, that is the allogenic and the autologous. Allogenic is nothing but transfusion of blood between the same species, that is from one human to another human. Autologous is nothing but the transfusion where a same person individual stores his own blood and use it when he needs it. Again, if you move into autologous, has got 4 types actually. One is the preoperative you have, and then comes with preoperative autologous blood donation, acute isovolumic, the one intraoperative blood salvage, and then comes with postoperative blood salvage. Indications. Any nurse who prefer to go for a blood transfusion should know for what reason, why are we giving this blood transfusion. Without knowing the purposes, the nurse will work like a robot. We are humans. We should be able to analyze for what it is so that, even in case for a wrong diagnosis, we give a wrong blood transfusion, nurse would be proactive and vigilant enough to stop and say, doctor, this patient has got such problem. For this, we do not prescribe such a blood product for him. They can stop it, and that's the reason why we say, like, before a blood transfusion start, the nurse must be able to know for what are we transfusing this blood for the patient. Here I'm going to talk to you about the 8 indications as such. The first one is your blood, whole blood. This is for mainly when there is a bleeding, that is 25% of loss or more than a blood volume, patient who's going to have a large volume of your exchange transfusion, patient who continue to bleed irrespective of the PRBC that you get transferred to the patient. Next comes with your plaque cell transfusion. Chronic anemia, irrespective without hemorrhage, the patient has got chronic anemia. Sickle cell diseases, any MIs, cardiac failures, a blood loss more than 30% over here, and then comes with your perioperative anemia. Then comes with your platelet transfusion. Here you should always see into where your platelet is into a defective stage, where it is not adequate in your body. Correlation, coagulopathy problem is there for the patient where your platelet count goes less than 50. Then comes your prophylactic transfusion reasons where your major surgery, ocular surgery or any neurosurgery, surgery with active bleeding also require for your platelet transfusion. My dear children, before you go into a platelet transfusion, have a look into what are the contraindications of the transfusions also, because you would be able to alert the doctors in case they have gone wrong. Then comes with FFP. FFP is mainly because when your coagulation factors or your inhibitors are under deficient, where there is less in body, where you need to give it. Warfarin overdosage, where your vitamin K deficiency comes into the play. Thrombotic cytopenic purpura, and comes with the treatment of the disseminated intravascular coagulation. Here also it plays a major role where your FFP transfusion is being given. Cryoprecipitate. These are very rich in factors number 8 and 13, and then comes with fibrinogen factor, von Willebrand's factor. These are the things where it is rich, which all patient who has got problem with these above factors which is being mentioned, for these patients we give it cryoprecipitate. Protein solution to for whom we have to give where there is any less amount of albumin in your body, patient who undergoes plasmapheresis, nephrotic syndrome, and then comes the liver failure. Granulate concentration is for the patient who with neutropenia patient. Mainly we can see this with the onco patient. Example. Then comes with your factor concentrate. This is especially for your hemophilia patient. And then comes with von Willebrand disease, Christmas disorder, Christmas disease, liver disease, where your factor 9 is into a concentrated problem over there. Severe sepsis patient also we give a factor concentrate. So these are the major 8 diseases that indications that you need to keep it in your mind. Now coming to the journey of the blood. This cabin, this chain which I have depicted here, everywhere the hands nurse lies upon, where she takes a major role in connecting right from the doctor's prescription till the patient's entire transfusion gets over, documentation gets completely, everything lies with her. She cannot miss a single step within inside it. She misses a single drop of blood in any of the space, the race gets spoiled over here. So that she has to keep it in her mind. Well, before moving into what is this cross matching, understanding the ABO compatibility, I would wish to give a live example today which happened in my hospital today morning. There was one 5-year-old boy who has got ASD disease, ASD problem he had, and he was supposed to came, he got admitted for the closure of the ASD. So once he got admitted, yesterday he got admitted, the doctor has very well prescribed like blood sampling, cross matching, compatibility, and then reserve blood as per the grouping, sampling what has been done. My nurse, very clean enough, the evening shift nurse has done for her, that grouping was being done. Cross matching was not being done. Without doing the cross matching, she just wrote that, reserved the blood bags and patient was shifted to the OT. Right when I entered morning by 8 or 8:30, I'm receiving a call from the senior cardiac surgeon stating that Niketna come to OT. When I went there, this was an entire mess over there. So I had to tell sorry to the patients over there, parents over there, have to counsel them. The time they have taken, consultants enter the OT by around 7 o'clock. And when they saw the first case that the case has been, cross match has not been done, how would they do? It's a 5-year-old boy. Who would I blame over here? No problem. I immediately arranged for anything, told sorry, delayed for another 1.5 hour. I immediately told the lab to get things arranged with. I'm sending the sample right now. And I called up this girl. This girl was literally weeping. I said, Beta, kya hua? Why did you do it like this? You're supposed to know that any blood sampling along with cross-match should go. Why didn't you do it? And she was like, blank. She was not knowing why along with the blood grouping cross-matching should be done and what is the importance of this ABO compatibility all about actually. So I thought I should put this in a story format for my little ones who's joined in this forum in this online, so that you will be able to understand, so that next time when you go to the patient's bedside, you should know that any sampling done, cross match should go along with it. They both are husband and wife, always remember it. Group sampling you do, cross match should be done. Husband and wife, two you should be able to send. So what is this story all about? Let's look into. So your RBC, why do you give your blood transfusion? You give your blood transfusion because your RBC cells is deficient in your body, so that your HP goes low. So now consider that your RBC is your house. Okay. So in your house you need 3 items. What are they actually? One, for a house you need a board outside. Yes or no? House ka board hona chahiye na. Bahar name of the house it will be there. And second one, you will have security guard. Yes or no? Every house will be having a security guard. Now many of the people are having gated communities actually. There also we have a security guard. And third one is your VIP sticker. If you've gone to any colonies, you would have seen any VIP stickers over there. What is that VIP sticker there? For example, DGP, judge, okay, and cricketer, actors, big names, a VIP, name label will be there. So keep these 3 things in your mind. With these 3 things, I'm going to tell you a small story. Okay. So here, the small board which is outside is going to be your antigen. So keep that in your mind. So this board's name can be A antigen or B antigen, or the third one will be your special board. The special board you will have, that is your RHD antigen board you will have. Okay. So always keep in your mind, board you will have it outside the house. That is A board or B board. That is antigen A and antigen B. Now inside the house, for a different thing, your security guards are going to sit inside your RBCs. Okay, so that is your antibodies, your security guard. Example, imagine if your name board is going to be A antigen. So your antibody inside of your house is going to be B antibodies. Okay, B antibodies. So it means only A family people are allowed inside. If any B people are going to enter inside, it is going to attack them. So keep that in your mind like that. So if it is B house, for B house, you will allow only B antigen inside. You're not going to allow A antigen inside. If A antigen comes inside a B antigen house, it's going to destruct it. So keep that in your mind. Okay. So inside a body, there are security guards called as antibodies. Their job is to identify the strangers and to attack them. A security guard always attacks only the antigen it does not recognize. Okay. Now, a small homework. Group A, okay, blood group. So what is the house name called as? RBC. Okay. Inside the RBC, what is the board name which is antigen outside? It is going to be A antigen name board. Security guard antibodies will be your anti-B antibodies. Okay. So it's for meaning A antigen is welcome inside. If B antigen enters inside, anti-B guard attacks them. So that means for a blood group A people grouping, you can give only A blood over there. Okay, if you give B antigen blood group, because B is going to have B antigen, if you give it, ultimately what happened? Their antibodies are going to attack them actually. So keep that in your mind. So this is just a chart which is in glimpse. You can see group B has got antigen board ka naam kya hai? Antigen B it has, antibodies A it has. It welcomes only B antigen and attacks A antigen. Whereas in blood group A and B, there is no antibodies at all because your husband and wife are coming together. Who are their husband and wife? Antigen A and antigen B comes inside. So they welcome both. So they don't have antibodies inside. But whereas this Mr. Blood group is very intelligent, he doesn't have any husband and wife. He got only security guard. He said, I don't want any family members inside. I want only the security guard to keep my house strong. So he has got only antibodies A and B inside it. So he attacks any antigen. So A and B cannot be given to group O people at all. So keep that into your mind like this. Just a tip. Now, third one I spoke about the antigen D, RHD. So this is your VIP sticker. So Jin ke paas, with whom and all RHD is there, they are considered as positive blood group. With whom and all RH factor is not there, they are considered as negative blood group. So now I think you all are clear. With A blood group, you have got A antigen and B antibody. A positive means it is RHD positive present with them. If you are A negative, you mean you don't have RHD antigen with you. As simple as it is. So this is the concept behind the compatibility and ABO compatibility that you have to look into. Now, what happens when a wrong blood transfusion occurs? This is what I told you. When a patient with A positive receives B positive, the anti-B security guard suddenly sees B antigen entering the house and will start shouting out that the thief has entered inside, an unwelcome guest has come inside, and will start destroying. Now, here the antibodies are very vigilant. They say that they not only attack the antigen which is coming inside, it will destruct the entire house, RBC. It will not give for anyone. It will not share its house with any other opposite antigen which is coming inside. Ultimately, when the destruction starts, these are the following reactions which the patient starts feeling, and you have to stop the transfusion immediately. Okay, so this is the concept which is running behind. This is why we say you have to check not only the grouping as well as the antigen compatibility test needs to be done. Okay, compatibility test or the example I'll tell you, grouping and sampling needs to be done. Crossmatch needs to be done. Okay. So, cross-matching is nothing but a laboratory test performed before the transfusion to ensure donor blood is compatible. Even if it is A blood, if you imagine. Whether that A blood is good enough for the patient to receive or not, you need to look into. Why do you have to do it? The major purpose is to prevent the hemolytic reaction, renal failure, anaphylactic shock, death of the patient. What are the components you look into? ABO typing you look into, RH typing you look, antibody screening you look into, compatibility testing you look into. Now in ABO compatibility, you hear the major thing that you have to look into is, right, whether A positive blood person can give for A positive. Now this is a advanced trial which is running in laboratory. Example, I'll tell you my own example. I am B negative. Okay, so after my pregnancy, my son was B positive. So still during one of my blood transfusion when I gave donation, you know what these blood bank people did? They took my blood sampling and they did this compatibility test for another patient actually. So when they test, they found that though I am B negative, I was not able to give to a B negative for another patient because I have RH anti-D present inside my body. So it attacks its own cell actually. Okay, so it will destroy the RBC cell of the patient whom I am giving. So no use of giving it. So immediately the blood bank people called me up and said, ma'am, though you are healthy, the compatibility test is getting failed, so you cannot give, you're on the banned list of giving blood donation. So this is how the ABO compatibility test works with patient action. Okay, a trial has been already run in the laboratory and checks the compatibility, and then only they'll be able to give. The nurses who works in the transplant unit will have a much more understanding about this ABO compatibility, because these renal transplant or liver transplants undergoes this ABO compatibility test multiple times in order to check whether they will be able to match the tissues or not. Similar thing which happens with the blood also. Okay. So here this chart which I gave you is your donor blood group for whom they can give it. Condition applied. This is only for your packed RBC transfusion, not for your plasma transfusion. For that, a different rules follows actually. Okay. Universal donor and recipient. A quick nursing mimic. Always remember, O gives out. O keeps on giving out. Out first word is what? O. So O negative is a universal donor. O positive can give only for positive patients. Keep it like that. AB, husband and wife, twins. ऐसे याद रखो आप लोग. AB is twins. Okay. So they keep eating a lot. So AB positive people can receive blood from anyone. Keep that in your mind. So OB always gives the most. AB positive receives the most. So keep this in your mind. So universal donor is O negative because they give for people, but they will not accept gift from other people. Universal recipient AB is twins, so they take food from everyone. So keep it in your mind like that. Okay, so your golden rule, antigens are the identity card of RBCs. Antigens, POTUS people cannot wear their ID card and work in Apollo Hospital. Yes or no? Security people will chase them out. So keep that in your mind like that. Antibodies are the bodyguards in your plasma. If bodyguard sees any unfamiliar identity card, it starts attacking. That's how the whole secret behind your blood grouping and compatibility comes into. Now moving down into your major nurses role before your collection is your first is your prescription that you looked into. Without a written consent, you cannot move for a further transfusion. This blood consent involves not only the patient but also the entire family over there. A separate counseling session will be done by the blood bank as well as by the doctors in the ward actually. Okay, the complete understanding, and then the consent should be in a dual language, written, taken, understood, and the handwritten to be taken. Which documents I have in the later section I'll be showing to you. Blood request form from the ward or ICU to the blood form. Blood grouping samples to be done, and special requirements. These are the blood that needs to be available or what it is you have to look into with regard to the blood bank. Okay. Sample collection. Always remember. Most critical step that involves never label away from bedside. Take the label next to the bedside, stand next to the patient, check it, then collect the sample, label it then and there, and then come out of the room. Don't say that me bahar jaakar kar lenge, I'll go outside the room and do it. No, nothing of that sort. Here you need to identify the patient, ask the UHID, double checker needs to be done, ask the name, you don't perceive, though you know the patient is there for 3 days, no problem, already you have given 4 units, no problem. Ask for the name once again, repeat their name, there again you can have your consciousness level of the patient. Checking also, they're saying in a Tamil, Ore kalla rendu manga, you can check whether the patient is conscious oriented, at the same time whether the patient is telling the right name. Verify the ID band, verify the UHID, and once you have collected everything, label it immediately. This is how the process should go. Don't break the chain. Don't go from A to C. Don't skip any step. Though even if you're repeating, no problem. Though it is taking time, no problem. Follow the ABCD step instead of jumping from A to D or A to C. Always remember, any wrong sample is always a wrong blood that you're going to give to the patient. Already patient is being with a lot of problems to the hospital. Do not give them with additional problems. Common errors what the nowadays is staff nurses who do: wrong patient identification, unlabeled sample, label applied later, similar patient's name, wrong identification, IPST1 not followed. Obtaining blood from the blood bank, always check with what components you have received. What is a blood group, unit number, expiry, integrity of the bag, any special instructions has been written. All this needs to be checked. Please don't trust anyone. Everything you need to read it with your own eyes. Don't tell me, even if your own sister, your own blood is working with you, sister. I have got a lot of sisters working here along together. Even if your sister has checked also, no problem. You please again cross check. Okay, transportation of blood. Always remember, blood is like an organ. Will you bring blood, take an organ, will you keep it in your room refrigerator? No. You will not store it, right? There's a specific refrigerator allotted in the blood bank. It's a designed one actually. So do not store your blood in the um, ward refrigerators. It is not valid actually. Your RBC destruction starts, the depletion starts very early actually. So please look into that. Once you start transporting, please start immediately the blood for the patient. Don't waste time on it. Bedside verification, always have a two people. One should be a nurse and one should be a doctor actually. Always we have two-step verification must be there, just like how you do for the high risk and LASA medications. Name, UHID, blood group, unit number, expiry date, compatibility tag, pause and check. 30-second pause for each and everything. Don't simply read out and go. 30-second pause for each and everything. Even in spellings, please check. Because see, in Punjab, I have got male and female will have the same number. Okay, Harpreet Kaur and Harpreet Singh. Harpreet Kaur is a female, Harpreet Singh is the male over here. So we carry the same name, but with Kaur and Singh, two different male sex gets divided over there. So please don't trust, read out the full name. I'm telling you with the examples. Just like how the medications have 5 rights. So please follow the 5 rights in transfusions also. Patient, blood, product, time and the right documentation you have to look into. Starting with a safe transfusion, basic vital signs are very much important. You have to look into, and any transfusion set, I have got history here with the nurses. They didn't have blood transfusion set. Blood transfusion set comes with a filter actually. Since it was not available, they have to start the transfusion. She started with a normal filter, which ultimately we have to ended up blood passing and flowing to the blood from the patient got delayed actually. So which got affected. We had to stop the blood. Then we identified that the set was different. So please look into all those things. Don't hurry up. Have a pause in each place. Basic vitals, and then comes with your set that you use. Remain first for the 15 minutes. Start slowly. Don't rush. However, you are in rush, please don't rush with the patient. If you are in a rush, don't start with the infusion. Give it to someone who is very patiently over there. And check with your baseline of the patient. Monitoring schedule. You cannot leave the patient and go for the first 15 to 30 minutes. Please, for heaven's sake, stand with the patient. Okay? 15 minutes is very crucial. You need to have your BP monitoring, everything inside over there. Keep checking with the patient. Then comes with 30 minutes, hourly, and then completion. You need to check 4 hours of post completion. Again, you need to check with the monitoring of the schedule for the patient. Now, coming with the documentation, these are the blood bank investigation form that we normally send from the ward or ICU to the blood bank that we sent. Okay, you can see all the details which has been written over there. Okay, so these are the blood and blood components requisition form that is over here. Every minute detail shouldn't be missed. The nurse have to read it twice and go. No blah blah business over there. Read each line. Don't miss each line. Read everything and check and then give your writing over there. Okay. And here this is your blood and blood component issue slip from the blood bank. This is the consent. See, in our hospital the consent is of 3 types actually. Consent part A. Part A is your consent for receiving transfusion of blood or blood components. The entire details is being there. This is why I told counseling should be there. The doctor makes the patient to read the entire consent. You know, 10-15 minutes the doctor will sit along with them. Part B is the education material for the blood donation. What is it? How much blood do you need to donate? How do I donate blood? This is for the patient who comes for donation actually. Entire education, everything is being done. And once they finish the 4th page, they understands and they signs and gives it to us. So please ensure that the consent form shouldn't be in a rush over here. Doctor has got a major role in doing this consent. Nurse has got a contribution and nothing. She shouldn't start the transfusion without completing this consent. This comes with your blood transfusion record. You can see in part A, the transfusion record is entirely written it over there. The first vital, 15 minutes, 30 minutes, 60 minutes, 90, 120, 150, everything is written. She cannot miss anything. Neither pre-advancement documentation cannot be made actually. This should be written, and there you can see pasty transfusion label needs to be pasted over there. So everything matters for us over here. Nothing can be left apart. Part B should be completed by a doctor. First part is for the nurse, second part. So here it is an equal contribution by the nurse and by the doctor. Any bag, once it is over, this bag should be returned back to the blood bank with the such following remarks filled actually. Okay. Any ADR, that is your adverse drug reporting, is being run, reaction is been happening. There is a separate form, suspected drug adverse reporting. Event form is there, you need to fill it and give it. Submit it. This should be given to the blood bank and they will do the needful of where to get it submitted actually. Transfusion reaction is your acute hemolytic reaction. Symptoms are fever, chills, back pain, hypertension and urine which comes in red color. Immediately stop the transfusion. You have to stop it. Recognize it. Act immediately. Okay. So these are the other reactions which is there. Stop the transfusion once you find a reaction. Maintain IV line with the NS. Immediately start the second line. Opposite line where you have to start and you have to start. Inform the lab as well as the primary doctor and the MO who is sitting over there. Send samples from the opposite hand, not from the same hand actually. Document the incident, whatever happened. Document it immediately. The ADR form also has to be filled. When in doubt, stop the transfusion. Don't say that blood to waste or blood is getting waste. Let's give it up. No, don't do it. Don't trouble the patient again. Stop it immediately. Okay. Hemovigilance, monitoring the entire transfusion chain to identify and prevent adverse reaction events is very important. India follows Hemovigilance Program of India, that is called as HPPI. Okay. So always remember your documentation, consent, order, cross-match details, start and end time of your transfusion, basic vitals, reaction notes, nursing signature and doctor's signature also has to be looked into. Good nursing care without documentation is invisible and it means that you haven't done that work at all. These are the few quality indicators that you need to follow, where your in charge mainly looks into it actually, and we have a register where we follow it. It's an advanced corporate hospital. We have this all in an Excel sheet in OneDrive, saved in the system, and it's all been tracked and submitted to the quality department once in a month. Your key home message, always remember the 5 golden rules: correct patient identification, sample labeling accurate, cross-match verification, bedside check, not on the nursing counter, correct monitoring and the documentation. Because always remember, blood transfusion is like your blood organ donation. So blood is a gift of life. Don't waste it. Safe transfusion is our responsibility. Don't be in a hurry. Thank you so much for this opportunity and sorry for the technical glitch in the beginning.
Thank you, ma'am, for your valuable presentation on blood transfusion nursing from Crossmatch to Bedside. Your practical guidance and emphasis on safe transfusion practices have reinforced the critical care role nurses play in ensuring quality and vigilance through patient safety through the entire transfusion process. We are grateful for your inspiring contribution and leadership. Thank you once again, ma'am. Let's move on to the second speaker for this evening, Dr. Deepthi Sachin. Ma'am is a senior consultant and clinical lead Department of Transfusion Medicine from Dr. Rela Institute and Medical Center in Chennai. With over 17 plus years of experience in transfusion medicine and apheresis. Ma'am is a member of Joint Secretary of the Indian Society of Transfusion Medicine and a convener for the therapeutic apheresis and cellular therapy. Ma'am is also an NABH assessor for the blood banks. Ma'am has been awarded and recognized with many of these awards throughout her experience in the clinical field. Ma'am has over 60 plus scientific publications in various national and international journals. Ma'am's key area of interest include patient blood management in solid organ transplants like liver, heart, lung, kidney, and combined. Advanced immunohematology, therapeutic apheresis in liver disease, stem cell collection, HLA and transplant immunology, quality and accreditation. We welcome you, ma'am. Over to you.
Thank you. So, good evening, everyone. My sincere thanks to Alvin, Nurseslab, esteemed speakers, Mrs. Niketna Nair and Professor Shilpa, and all the participants for joining us today to celebrate this World Blood Donors Day 2026. We are celebrating tomorrow World Blood Donors Day 2026, and this every 14th June we celebrate as a birthday of Karl Steiner because he discovered the blood group ABO, and because of that, the transfusions are actually possible. So this year, the theme is One Drop of Humanity, Give Blood, Save Lives. So I want us to think about a simple idea, that is one drop, one blood. Every drop of donated blood carries something beyond red cells, platelets, and plasma. It carries hope, it carries time, and yes, sometimes it carries life also. We can see here a globe in front of you, and we can see the countries, the continents which are connected through blood drops, because actually blood knows no border. And many times the donors are from one part of the world and the patient is from different part of the world, and they can be connected by blood or they can be connected by humanity. Another important thing is that despite the medical advances, millions of people are facing the reality of shortage. They are not getting the blood when it is required. And that leads to a very important question, that where on one side the world is so connected, but still sometimes um, as simple as fundamental to blood, it is not equal. There is equality is not there. So I'll be discussing about this global blood crisis in 2026 and why it exists, who suffers, and most importantly, what healthcare professionals, nurses, blood services, each one of us can do to change this problem. So why blood matters? I think before starting to talk about the crisis, we should understand that why it is so important. We can think of a road traffic accident where the patient is arriving in ER, or we can think of a mother or a pregnant female after the postpartum hemorrhage, or we can think of a child with thalassemia or sickle cell anemia who comes and waiting for a transfusion, a cancer patient who is receiving the chemotherapy. There are different patients, different diseases, different backgrounds, or they may be living in different part of world, but they all have a same common need. They all need blood. Blood transfusion is actually one of the few medical interventions where we are actually connected to various specialities: emergency medicine, surgery, oncology, obstetrics, pediatrics, transplantation, critical care. Somewhere, someone every 2 seconds is asking for blood. And what makes it more unique, that in spite of various advancements, still there is no substitute. And somebody has to donate blood, then only the transfusion begins. And we need to understand that how is the global blood supply. So let us look at this global picture. Globally, around 120 million blood donations are happening, which looks very impressive. But actually, this blood availability is not equally distributed. We can see here in this picture that the high income countries, there will be a higher collection seen in green, and then it goes down to low and middle income countries to much lower, that is as low as 5 or less than 5 per thousand population. So there is a difference. Higher income countries are maintaining the supplies while low and middle income countries are struggling with shortages, infrastructure limitation, access issues. So actually it depends that where a person lives will determine that whether patient will get life-saving blood or not. And also the challenge is not collecting more blood, but also to ensure that we get the safe blood to the patient when it is required. So blood actually should not be a privilege, it should be access to all. How unequal it is, we will further talk about it. We'll just see the difference, how it is different in high income countries and low income countries. So just to understand, in high income countries, they have better collection. For example, around 30 donations per thousand, or you can remember as 3%. And for every collection, they are preparing components, so almost 100% components. They have better screening and blood safety. They are mostly voluntary donations. They have public awareness, better infrastructure, and they have better blood safety. But when we talk about the low income countries, the donation rate goes down to 5 per thousand. That is 0.5%. That means in every 100, not even one person is donating. Still, for example, in our country, still 100% we are not separating blood components. Still, many places whole blood is being used. The testings are variable, and still we are depending on the replacement donation. So we can understand that we need to make it accessible to all, and it should be available in all cases, irrespective of where from which place. So coming to uh, that, why we are facing this crisis, that is, we need to understand that there are different drivers, what the reasons why there is a crisis happening, and the crisis can be because of aging population, because of increasing age. There is for the elderly patients more supportive treatment related support is required. The cancer treatments are becoming more complex, and that is causing the more requirement of blood. The surgical surgeries are becoming more complex, and the trauma cases are increasing. The natural disasters, the emergencies are causing the increase in demand, and at the same time, the blood services are facing a shortage of staff. There might be shortage of donors. There is a seasonal shortage. Whenever there is summer holidays or some festivals, we are finding the crisis of blood donation, and many times the workforce is also less in places to collect the blood. So simply putting it, that demand and supply, if we see that there is often an imbalance is happening. On one side, we need various reasons, various ways to get the blood. On other side, we have to keep a balance because the demands are increasing for various reasons, as I said. And this balance, if there is every shortage is actually a patient which is not getting blood. So it can affect the children, it can affect the women, and it can affect the trauma patients, cancer patients, and this is a real shortage. And this is not a one place problem, this is actually a global problem. This shortage of blood is not in one country or one city. If we see, there are various reports coming from different places, various countries, which says that there is a critical shortage of O negative and O positive. As the previous speaker also told, O negative is a universal donor and O positive also can be given to any group patient. The red cells can be given. And if we have shortage of this, actually we are having shortage of all blood groups. Also, the hospitals, they are operating with very less stock. So if there is a patient bleeds more, we are going into trouble. The blood donation camps and drives are actually getting affected by illness outbreaks, the travel patterns, and different donation rates. There are many times the donors are giving excuses because of work schedules and all. We are getting the lesser number of donations. And also, it is important that these shortages are not one-time incidents, and we need to find a long-term solution rather than no immediate just as a response to work on it. Whenever there is a shortage, only one time to do. We need to plan for something long-term solution so that these shortages can be worked out. So, who suffers the most? The patient who suffers most, who may require blood, like children with anemia, most commonly thalassemia patients, and patients, women with delivery time, they may require blood when they have hemorrhage, trauma, cancer patients, various surgeries or transplantation. So it may be anyone. It may be our family members, our friends, our grandparents. I think every family gets affected at certain point of time where they may require blood. It may be you, me, or anyone we know. So it is important that we understand the importance of donation, and it is not very simple. It's like a journey. It's a journey where when the patient requires blood and what all those steps are happening to make this happen and to save the life. So we understand that for any blood patient requiring blood, we need a donor, and the donor is when donates voluntarily. It is a safer blood. It goes through various testing. So we do testing for 5 markers: HIV 1 and 2, HBsAg for hepatitis B, hepatitis C, malaria, and syphilis. And we ensure that what we are giving blood, it should be not giving any more infection. And then the various components can be prepared, as told by previous speaker: red cells, platelets, plasma, cryoprecipitate. We have storage shelf life, and we keep it safely in the blood bank. And whenever there is a requirement with a blood request, we issue it. And after transfusion, it helps the patient to stabilize and to improve the condition, and we can go back. So this is it requires multiple steps, and every step is very important, and we all play a very important role in making it happen. And actually, it saves life when we take care of every step, and the transfusion becomes successful and patient help. Also, I would like to tell that we are now talking about red cells. Most of the time, we talk about red cells, but there are importance of platelet and plasma products also. So for plasma, we need to understand not only blood, various plasma products are also there. So if the plasma is not used in blood bank, it goes for fractionation where various medicines are made. So when the donors are not donating blood or plasma, we are ultimately may go shortage of these plasma derived medicines also. For example, immunoglobulins, clotting factors, fibrinogens, and various other plasma derived products. And it also becomes important that we are not only playing for blood important role as donors, important role for blood or platelets, but also plasma related components. So for that also it is the same way, like how the donor registered with the help of apheresis method. We call it platelet pheresis when we donate platelets, and when we collect plasma, we can call it plasma pheresis, which takes around 45 minutes to 60 minutes. Again, we do test and we process the component. When we are sending it for fractionation, it goes for manufacturing of various products like albumin, immunoglobulin, clotting factors, and these are required for various conditions. Like immunodeficiency patients will need immunoglobulin, bleeding disorder patients will require clotting factors, and various liver patients and burn trauma patients, cancer surgery time, we use albumin. All of us must be using 5% use albumin or 20% albumin. Remember, although it is coming from pharmacy, they are all derived from the human blood. So someone somewhere is donating blood, and that's how we are getting these plasma products also in our ICU or various other. So coming back to the important point that as healthcare professionals, particularly this blood availability, it is actually a, a health responsibility, which is a public health responsibility. It is not just a matter of a hospital, because when the blood is not available, the treatment gets delayed, the surgeries get postponed, and somebody may lose their life, and it is a matter of life and death. So it is a public health responsibility. As a healthcare professional, particularly the transfusion team, the nurses, we stand at the center of this responsibility. And nurses contribute far beyond the administration of blood. How they contribute? They educate the donors in blood banks, they support the blood collection, they motivate the patient during transfusion, they identify that adverse reactions, they contribute to hemovigilance and patient safety, and they also reassure when the donors are anxious or when the patients are frightened or scared for blood transfusion. So these nurses, they play a very important role, and actually every safe transfusion begins and ends with a vigilant nurse. And it is the role of nursing which is very important, and it extends far beyond the administration of blood. It includes the advocacy, education, and leadership roles. And because of their safety care, compassion, and they play a very important role in the transfusion, in blood transfusion. Again, I will emphasize that nurses can bring more change. They can make a difference. How they can make a difference? By educating communities, by helping organize blood donation drives. They can, they can spot the people have various myths and misconceptions about blood donation. And most commonly, the patient attendants are nurses are dealing with them. If they can challenge this myths and misinformation, misconceptions, they can help people come forward for donation. They can motivate the repeat voluntary donors and can encourage the young people's participation. And most importantly, they can use the social media to spread the awareness. So actually, our nurses are very important, and they can become the blood donation ambassador sign. So yes, we are having shortage, we are having crisis, but there is an optimism. We are everywhere. The technologies are changing, and this technology also is helping us also to improve the blood services. We are improving slowly, and we are connecting globally. For donor recruitment, we are finding there is digital programs are there where we can engage to donors in better way. We are having mobile collection units so that we can go closer to donors and we can improve the accessibility. We have now it's coming is artificial intelligence assisted inventory management. The blood tracking is becoming real time. And there are various patient blood management programs which are helping us to use the blood appropriately. These innovations are helping create more smarter, resilient, and sustainable blood systems. But this is not enough because behind every technology, every blood bank, every laboratory process, there has to be one donor. And there it brings back to the power of one donation. By one donation, single donation nowadays it is not one unit. Now we know that one unit we can prepare three multiple components. So one donor can impact multiple families. One donation can create various ripples of hope. It can be separated into components, red cell, plasma, platelets, cryoprecipitate, and as it was told, various indications these components can be given to different patients at different places, different wards, and it can save multiple patients. And with this, I will come back to uh, this that blood does not recognize the borders, it does not recognize language, it does not recognize religion, race, or nationality. It only understands the humanity. So, what we can do, we can continue to build systems which are more stronger, and we can make the communities more aware, and a future where patient is not denied of blood. We make it available. So, how we can do it? We can donate regularly. If we are eligible, we should donate. At least we encourage one new donor to donate. We promise ourselves that either we will donate or we will recruit one more donor. We support the voluntary blood donation without any payment. It should be non-remunerative blood donor. We can strengthen the programs, the national blood program, and try to make the safe blood access to everyone. And the solution of global blood crisis lies not just only on blood centers, but also in communities, healthcare professionals, policymakers, and all the donors who are all working together. So with this, I conclude I leave with this one thought that a single drop of blood knows no nationality, no religion, language, or border, and it carries only one message, that is humanity. And on this World Blood Donors Day, let us honor every donor, every nurse, every blood center professional, every healthcare worker who makes this transfusion possible. And let's together we can transform one drop into millions of drops, and it can work as a hope for the patient. Thank you.
Thank you, Dr. Deepti Sachin, for that enlightening session on One Drop, One World, the global blood crisis in 2026. Your expert insights into the current global challenges of blood availability and the importance of strengthening blood donation systems have broadened our perspective and reminded us that every drop truly matters. We sincerely appreciate your time, expertise, and dedication to advancing transfusion medicine. Thank you once again, ma'am. We will now move on to our third speaker for this evening, Professor Shilpa J. Ma'am is a MSc in Pediatric Nursing and currently pursuing her PhD in Child Health Nursing with over 15 years of experience in the teaching field in pediatric nursing and more than 12 years as a nurse and an SNA advisor. She is also as administrative leadership as a professor and a vice principal. Ma'am has also counseled many nursing students and is an active member of the board of SNAI. Ma'am has also had many awards and recognitions from Nurseslab Leadership Award for Emerging Clinical Nursing Expert and the jury member of International Conference on Healthcare Education and Research. Ma'am has numerous national and international publications as well and is the author of 3 textbooks. We gladly welcome you, ma'am, and over to you.
Thank you, Tanya. So, my given topic is on nurses as an ambassador. That is, I hope you all know what we are. We are very proud to be a nurse. So, why we are into this? See, here, okay. So, first of all, I want to welcome Dr. Deepthi Madam and Niketna Madam because already both have taken my session. And it will be just a revision session for you all. Still, I'll be dealing with this because I have been given this topic and I have to proudly present this topic, and I'm really proud and thankful to Nurseslab for this great opportunity. See here, as mentioned, every 2 seconds we need the blood. Or the world needs the blood. Blood is a life-saving resource that cannot be manufactured artificially. Maybe in future it can happen, but blood is a life. It cannot be manufactured artificially. So we should be grateful to our God, who is the real manufacturer. Okay, so voluntary blood donation remains the cornerstone of a safe and adequate blood supply. So today's learning objective will be, at the end of the section, you as a participant will be able to understand the importance of blood donation as Deepthi Madam has dealt in detail, explain the role of a nurse in promoting blood donation as both the speakers have really they have explained also, and identify the strategies to increase the voluntary blood donation and act as your advocates and ambassadors for the blood donation. Here you can see one drop of humanity, give blood and save the lives. Yes. World Blood Donor Day. It is observed every year on June 14th. Why? Are you all aware of it? Yes. It is the birthday of Karl Landsteiner, who has discovered ABO blood groups, which is the main turning point of our history. So, he is the discoverer plus the Nobel Prize winner whose discovery made safe blood transfusion possible. So, what are the purpose of World Blood Donor Day? Why we are celebrating this event and every June 14th? So, it is to raise the awareness about the blood donation, that is to educate the communities on the importance of donating the blood, increasing the understanding of how blood donation saves a life. And thank voluntary blood donors. You have to appreciate their sincere efforts because they are the ones who is coming forward and they are giving the blood to save a life. Encourage regular donation. It is not like I have donated this time, next time I will not do it. You have to always encourage or motivate the donors and ensure a stable and continuous blood supply from the donor, and promote universal access to the safe blood. Here you can see advocating for the safe, quality assured blood and blood products for everyone in need. As Deepthi Madam was saying, we are not supposed to add any ingredients while blood transfusion, which is a very true thing. Okay, you are not supposed to add anything except for the normal saline. So every drop counts, every donor matters. We have to sincerely appreciate the donors who is coming forward. Global statistics. So here what we have seen is the key statistics is, as Deepthi Madam has already said, it is the blood in which we are donating to the accident victims, surgical patients who requires blood, cancer patients, obviously yes, they are in need of that. Maternal emergencies, like you all know that in the normal delivery or the C-section, we used to keep a donor ready so that immediately, on immediate basis, we will take the blood. Yeah. Then, children with anemia and thalassemia, as being a pediatric teacher, I have seen many of the children with anemia. It is because of the lack of breastfeeding from the beginning, from their babyhood, which is leading to anemia, and thalassemia, which is a hereditary disorder. Okay, so here you can see demand often exceeds supply. Actually, whenever we are in need, that time we will not get the blood. So what we have to do is constantly educate the patient or whoever, constantly educate the community for the blood donation. The need is constant, the gift is priceless, so we have to always donate the blood. Yes, blood is the gift of life. As I said, only the creator, manufacturer is the Almighty God. So we have to surely donate the blood and be encourage, motivate others to give the blood. Here, you know what is the importance of the blood? As in the anatomy physiology, we all used to learn this for the easy oxygen transport, for improving our immunity, for the clotting mechanism, and for the treating or the treatment of the critical illness. So these blood supports for this thing. Okay, one donation can save up to 3 lives. So here, as Desivan has already said, the blood will be divided into the sections. So here we can see that blood donation in India, what are the challenges we must overcome together? We should keep in mind seasonal shortages. That means at the festivals like Holi, Deepavali, obviously yes, the children or the elders, everybody used to come to the burns unit for the blood. I have seen the cases and in these emergencies like accidents. Okay. Myths and misconceptions, yes. Wrong beliefs like blood donation will cause weakness. No, certainly no. You have to educate the donor. It is a very good humanitarian act. What you are going to do is that means you are going to save a life. So you are the one who have to encourage the patient to donate the blood. Fear of needles. See, I am also having a fear that doesn't mean that we will not take an injection, right? So anxiety and fear of needles or the process of donation stop many of the people from taking the first step. So you have to motivate them. Okay, whatever it is a just for just a prick. That time only the pain will be there. So you should know how to tackle with the donor. Lack of awareness. Obviously, yes, many of the people are not aware of the need of the blood. Why we have to donate the blood? They will be asking so. Like many of the students, whenever I am asking them to donate in the World Blood Donor Day or any camps, blood donation camps we used to organize. So that time my students used to ask, Madam, I'm scared. I used to encourage and motivate the students and I see to that if they are healthy, they will surely give the blood. So that should be the spirit. And inadequate repeat donors. First time donors don't always return. So you have to always encourage them. Your blood will purify. Your body is purifying. So whatever it is, you should motivate the donors. Next, why we nurses matter. Nurses are, so whatever it is, we are the community educators. This also has been dealt by Diti Madam, that is, we are the educators, patient advocates, health promoters. So, as a nurse, we have to encourage whoever is coming to the side. So, compassion, care, commitment, that's the power of a nurse. So, you should know how to deal with the donor. People often believe healthcare information when it comes from the nurse. Actually, we are the one who stays with the patient throughout or the donor, whoever it is, right? So we should be very happy that at least the patients trust us the most. So here, whatever we say, the patient or the whoever it is, they will be accepting it. Okay. Next, who is the blood donation ambassador? See, I have told this is my topic. So, who is the blood donation ambassador? Yes, I am also one blood donator ambassador. It is the one who inspires others to donate the blood and helps build a healthier, stronger community. Yes, you can also become a blood donation ambassador. She is the one who promotes voluntary donation. You have to continuously motivate or encourage the people to donate the blood and voluntary and regularly to help those who are in need. Educate the public. Many of the students I used to say you have to go and give health education in the community or the rural area or the urban area, wherever you are going. Please educate the community so that you will be sharing accurate information about the blood donation for its safety and its life-saving impact. Motivates potential donors. Yes, inspires and motivates individuals to take the first step. As I said, whoever is coming to me, I used to motivate the student and they used to give the blood. Dispels myths and facts. Here it is. Here the nurses play a very, very important role because as a nurse, you are supposed to clarify what is good and what is not. Myth. It is very painful. It is not safe and it makes you weak. It is not like that. The fact is, it is very quick and safe. Your body replaces the blood naturally. So, whenever you are clarifying the doubt, obviously, yes, the donors will be getting ready for the blood donation. Encourages repeat donation. So, you have to motivate the donors to repeatedly donate the blood. An ambassador is a hope bringer. She brings hope, a lifesaver, and a community hero. So, as a nurse, you all have to take a pledge in yourself that I will be a blood donation ambassador from today. Next, be a hero, donate blood, and save the life. As a nurse, I care for everyone. As an educator, I inform the students or the one who comes to me. As an advocate, I inspire them and together we can save the life. See, here I was keeping my photo because I am already a blood donation ambassador, so I can do it and together we can save countless lives. It is not one or two. We can help many of the patients through the blood donation. Okay, so why you have to donate the blood? Saves lives in emergencies, supports the surgeries and treatment, gives hope to the cancer patient. Yes, actually it is like last hope, but we as a nurse we have to encourage them. The blood is ready, so it gives some hope to them. Okay, helps in maternal and child care and strengthens the community health. Be the reason for someone's life today. They will be always remembering and they will shower their blessings to you. So donate the blood and be a hero. Next, nurses as a change maker. As I said, nurses will be influencing everybody, including the family, the society, as a health educator and in the community group. Not only in the community group, I'm talking about the community health nurse. We are not as a nurse, we are all over. That means not in the hospital, but everywhere in the world. So here you have to say in yourself, I can do it and I have to do it. Okay. Next, what are the benefits as Madam has already explained for the recipients? Okay, so for the recipient, what is the thing? It will be saving the life, it will be supporting the surgeries and treats trauma victim patients. Okay, and for the donors, what is the very good thing for the donors? Yes, their blood will be purified, and before that, the health screening should be then. Then sense of social responsibility, it will be creating a social responsibility, and the donor will be psychologically satisfied. Okay, the joy of helping others brings happiness, and I am into the happiness because I used to take classes how to be happy always. So in the happy, there is a hormone that is dopamine, oxytocin, serotonin, and the endorphins. Okay, so these are the happy hormones. Whenever you do a great thing, you should be very grateful and you should be gratified enough. Okay, be a hero and donate the blood. Next, who can donate the blood? Yes, these are some of the things that means if you are 18, yes, of course, and you are healthy, yes, of course. If you are a male or female, whatever it is, you can donate if you are healthy. So, the age starts from 18 to 65 years. Okay, you should be very healthy. Because of that, we are screening for the blood for the hemoglobin level. Your weight should be appropriate and adequate hemoglobin should be there. Next, blood donation process. Yes, this is the main thing how you are going to donate the blood. Registration first. Yes, you have to register first. After that, your health will be assessed by the doctor and the nurse. Hemoglobin checking will be there. If your hemoglobin is very good, yes, the blood collection starts, which is a gift of God or gift of life. You should be always grateful to the God that I am going to save a life. At last, even for the students, I used to say that you will get a certificate of merit, and it is a very great achievement as a student if you are getting the certificate. Next, as Madam has already said, components of blood, that is whole blood. We are not giving the whole blood. We will be always separating the blood into red blood cells, plasma, platelets, and cryoprecipitate. The main use of red blood cells is it is used for the anemia. Okay, if the patient or the children, especially for the children and the women who requires who is diagnosed as anemia, especially the iron deficiency anemia, we will be treating with the red blood cells. Blood loss during the surgery, especially in cesarean section, accident victims and chronic illness. In these cases, we will be giving only the red blood cells. Plasma, yes, severe burns. You can always see plasma transplantation in the burns ward. Liver diseases, floating disorders, and shock and trauma. Platelets, exactly, you have seen going through the dengue. In that, always the platelet count will be so less and immediately platelet has to be replaced. So, here, dengue, cancer treatment, yes, bone marrow transplant, and the bleeding disorder. In these cases, we'll be donating or the transfusing the platelets. And cryoprecipitate is used for the hemophilia, liver disorder, massive bleeding due to the road traffic accident and the cardiac surgery. Okay, so one donation can save up to 3 to 4 lives. Great, right? Next, myths and facts. As I already said, it can cause donation. Weakness. Blood donation causes weakness. You have to say no. You will be so energetic after the blood donation and it is painful. No, you should say that. Only minimal discomfort, child. Here, you have to give. You have to get ready with the blood donation because you are going to save a life. Okay, next, even the woman who is menstruating, she can also donate the blood if the HB is high. Okay, so here what I wanted to say is, even if we are having menses, even I have donated the blood when in period, but the thing is that your HB should be correct or like 12 to 13, okay, and you should be in a continuous observation. There will be a sudden drop in your HB. So under observation, a menstruating woman also can donate the blood. Okay, healthy women, yes, we can do it. Healthy or adults, means old age people also can donate the blood. Next, fear and anxiety comes. Yes, I am with fear of needles, I will get fainting, I will get infections. So you have to, as a nurse, you have to help educate the donors that these are just as it is. So you have to do the reassurance, counseling, pre-donation check, and obviously, yes, the patient or the donor, they will say, I trust you, so I'm ready to donate. So that words of trust, you have to keep it. Okay, next, what all skills you should have as a nurse ambassador? Exactly, yes, we should have the communication skills. Why this is very more important? Because, see, for a patient or a donor, you should be listening to them, not always talking to them. So be a active listener. Empathy and sympathy. Show compassion and care. Put yourself in other person's shoes. Clear the information. You have to clear all the doubts, whatever they are asking. Positive reinforcement. Yes, exactly. You have to always encourage and motivate the patient or the donor for the good decisions and efforts to build their confidence. Motivational interviewing should be done, and strong communication creates trust, inspires action, and saves the lives. A compassionate word today can inspire our life-saving action tomorrow. So always be compassionate with the donors who are ready to donate, and it can be a life-saving action. Next, counseling potential donors. You are supposed to counsel the donor. Talk to the patient, talk to the donor, educate the donor, reassure and save the life. So those main key messages are like sterile equipment will be used. First of all, you will be screened. Donation is very safe. Body replaces your donated blood. Every donation matters. So you have to first of all counsel the donor that it is a very safe and secure procedure. Your decision can save a life. Next, community awareness program, as Mr. Madam has already said, we have to conduct camps, health camps, college programs, community way, social media. So these are the most of the role as the blood donation ambassador. Leadership role, yes, we are the key leaders of in blood donation also. See here, what I have kept is we are mentoring the students, develop donor network. Yes, as a donor or the ambassador, you have to create your own donor network so that we will immediately, whoever is in need, you will get in contact and you will get the blood immediately. Leading of campaigns, that means you will be conducting many of the campaigns and you will be getting up connected with all the donors. Collaborate with any of the NGOs too. Next, inspiring future nurses. You as the ambassador, ask yourself, how many lives can I influence by encouraging blood donation? My answer is yes, thousands. I have counseled many, encouraged many, motivated many. So I can bravely say that yes, I have encouraged many of the donors to donate the blood, and the answer may be thousands. It is almost more than thousands. So I can influence a lot of people for the blood donation. See, now for you all I can say is call to action. That means you all have to become a blood donation ambassador today. That means you're encouraging, educating, donate, right? You have to do it. First, you have to be well prepared and you have to share the information, encourage others. Okay? So, what is the key takeaway message? Yes, blood saves life. Every drop counts. Nurses are the trusted advocates. Yes, everybody says that I trust you. So, you have to keep your trust. Voluntary donation is essential. Become a lifesaver. Every nurse can become a blood donation ambassador. It is not only me, each and every one who is participant over here. You can become a blood donation ambassador from today onwards. The education reduces fear and fear. Hope it is understood. Is there any queries? So thank you all for this session. Thank you, Tanya.
Thank you, Professor Shilpa J, for your inspiring session on nurses as blood donation ambassadors. Your presentation beautifully highlighted how nurses can influence communities, encourage voluntary blood donation, and become powerful advocates for saving lives beyond the bedside. Thank you for motivating us to lead with compassion, awareness, and purpose. Thank you once again, ma'am. On behalf of Nurseslabs and all our participants, we extend our heartfelt gratitude to our esteemed speakers for sharing their knowledge, experience, and passion with us today. Your contributions have made this World Blood Donor Day 2026 webinar truly meaningful and impactful. Thank you for inspiring the nursing community and helping us advance the mission of saving lives through education and advocacy. As we come to the end of today's national webinar on Blood Donor Day, we would like to extend our heartfelt gratitude to each and every participant who joined us this evening. Thank you for taking the time of your busy schedules to be part of this meaningful learning experience. Your enthusiasm, active participation, thought interactions, and commitment to professional growth truly made this webinar a success. We hope that the knowledge and insights that were shared today will not only strengthen your understanding of blood donation and transfusion practices, but also inspire you to become advocacies for blood donation voluntarily within your workplaces and communities. On behalf of the entire Nurseslabs team, thank you once again for your presence, support, and dedication to advancing healthcare through continuous learning. Together, let's continue to empower nurses, enhance care, and save lives. Have a wonderful evening and stay safe. Thank you.